This next guest said that we might find him buried in the desert of Nevada because he is so cutting edge. And you're going to see why in this episode. Dr. Jeffrey Gross calls himself a recovering neurosurgeon. He graduated from the University of California, Berkeley, with a degree in biochemistry and molecular cell biology. He achieved board certification by the American Board of Neurological Surgery. But when he started his career, he realized that there must be so much more that he could do for his patients than what the algorithm allowed. So eventually he founded Recelebrate, and the word cell is in there at C-E-L-L, Recelebrate, focusing on anti-aging and regenerative medicine. Their mission emphasizes offering modern biochemical treatments and considering surgery as a last resort. Imagine that. And imagine that he actually asks his patients, in addition to their knees hurting or their back hurting, he actually asks them how they sleep and how they eat and all kinds of crazy things. Anyway, I got so excited that I think I'm going to make an appointment to see him. And of course, I will film and document that. So without further ado, let me introduce you to Dr. Jeffrey Gross. Dr. Jeff, I'm so excited that you're on here with us.
Thank you for having me. This is great.
All the way from Las Vegas.
Correct.
Okay. So let's dive right in and tell our audience, what do you do?
So I practice regenerative medicine. I'm also a recovering neurosurgeon.
Oh, a recovering neurosurgeon. I can't wait. Okay, so I call myself a recovering medical gaslighter. Bro, wait, before we get to the regenerative medicine, we have to hear the story. What does that mean? Tell us what you were before and then what you are now.
Yeah, I was a neurosurgeon with a spine fellowship. Most of my career was dedicated to helping people with neck and back type pains and problems and injuries and disc problems, pinched nerves, all that, whether it was, consultative advice, ordering therapies, ordering MRIs, figuring out the source of the pain, guiding injections, or in some circumstances, even surgery. And I had done that. I still do a little bit of that in terms of second opinions. And I take on complex cases and failed cases that were treated elsewhere and all kinds of nonsense. But that is something I'm doing less and less of. And it has largely been replanted by my regenerative medicine practice.
But what happened? What made you say, this is not that?
Well, a number of things. My patients get the main credit for bonking them the head with a rubber mallet a few times. And it was the patients in the gap between the non-surgical treatments and the surgery, because a lot of people don't have lasting benefits from physical therapy or, getting a core strengthening or even spinal like epidural injections. They might help for a minute, but they didn't last long enough. They'd come back to me and say, yeah, I'm still having this pain. My foot is numb, whatever. And I say, yeah, I see the disc issue on your MRI. Okay, are you ready for surgery? Because that's next on my menu.
Sure.
And he'll say, no, I'm not ready for surgery. I say, great, because I really didn't want to offer it to you anyway. So, and they would say, well, what do we do now? I said, well, what do you want to do? And they'd say, well, how about this? How about lasers? How about this? How about stem cells? And you hear it enough times, and chance favors the prepared mind. And my undergraduate work is in molecular cell biology. And I thought, you know what? A lot's happened in the many years since I went to college. So let's take a look back. And instead of going to these annual neurosurgery meetings where people in bow ties pat themselves on the back for doing the same thing for decades, I finally said, something's got to be new and better and move faster than the big pharma and big implant companies want us to move. So I started going to stem cell regenerative medicine meetings and conferences and education, got retrained, and it just sort of blossomed. And the nerd in me just took that on. And I said, you know what? We have all kinds of options we're missing out on. And they're doing these things in Europe and in Asia, and we are so suppressed here in the US. And I said, well, you know what? I'm going to disrupt that and add it not only for my spine patients, but it's so many other things we now do.
Oh my God, I love this. I want the audience to know, listeners to know, you describe the spectrum so well, because I have a primary care practice. And really, right, who is not coming in with back pain? And it's really all we're allowed to offer: physical therapy, chiro, and then injections, epidural steroids. And there's a limited amount you could do because they have a lot of downsides. And then surgery. And that's it. And people come to back pain. I'm like, what of these three things on the menu would you like? And there's nothing there. It's so interesting because most people are falling in the middle. Physical therapy, okay, whatever. The injection, like you said, doesn't last a long time. And, who wants surgery if they can avoid it? So you're talking about most of the people who are not being managed by the algorithm at all. Wow, amazing. So tell us what you do with this stem cell. This is great.
Yeah. Well, I've always been pushing against the algorithm because the algorithm makes, big pharma and other companies money. That's what the algorithm's for, right?
Yeah.
So I've learned now to go on a more functional side of things, and we break down someone's lifestyle. How's your sleep? What's your exercise like? What are you eating? If we can go from an inflamed diet to an anti-inflammatory diet, add the right supplements, probiotics, what have you, we may reduce the overall systemic inflammatory burden in the body, and that can help with pain, because a lot of pain has an inflammatory component. Not all, but a lot. So we deconstruct, we break it down, we look at all aspects, and then we add potentially regenerative medicine as an option, but not just for spine. I do a lot of structural work, joints and spine, because I come from that side of things, and that comes easy to me. So we do this very high quality MRI images, because not all MRIs are the same. And we look to match up or correlate someone's symptoms and problems with what we see on the MRI. And when we find those targets, I follow a protocol that's been in Europe the protocol's over 20 years old, but their long-term follow-up data clinically is published over 15 years of data. So they have wonderful results. We follow that protocol. So I'm not redesigning anything. We're just taking the best practices and putting them all together to help people avoid knee replacements and all kinds of things.
So I'm loving this so much. And I'm loving that it's not just spine. So you're doing knees and shoulders and amazing, which is also out of the box, right? Because neurosurgeons don't touch the extremities, right?
Typically that's correct. But luckily, medical school and residency, rotating through orthopedics, it's not that difficult. I'm not doing, hip replacements. We're just doing injections. So, primary care doctors do injections, right? So
yeah, I always found that ortho does extremities. And then it's just the more you spend in functional medicine, and I understand the need for specialization without question. As things get highly specialized, there's a lot of training that happens. But it's weird how we decide to split up the body. And think about it, you guys are in charge of this, you guys are in charge of that, and let's not talk in between. Like your knees and your spine have no connection to each other whatsoever. And I'm loving that you're introducing the functional medicine piece. Because when was the last time you went to a neurosurgeon and they asked you how you're sleeping, how you're eating? It never ever. I love that.
That's for sure. So I've really enjoyed that. I like interacting with patients. So sitting with them and talking, it's not that watered down institutional government, driven 5-minute visit, because you're not going to get anywhere with that, right? You're going to miss stuff.
You're not.
You get too specialized, right? Just tell me about your spine, and you don't hear about the rest.
Exactly. And only your lumbar spine. I don't want about your thoracic or your cervical.
One problem only today. Yeah.
That's so true. One problem only today. But I wanted to, no, we're not allowed to do that today. That is so funny. Oh my goodness. Okay, so before we get a little bit more into what you do, because I'm so interested, tell me about that transition period. I was just talking about this yesterday because I'm writing my second book, this transition period when you're first discovering this. I remember for myself, I was terrified. I was terrified of pushback. I was terrified of my colleagues. I was terrified to really come out and say. Right now, you're really comfortable in it, but I imagine that wasn't the case in day one. Tell me about that transition, if you had it at all, or if you felt any pushback.
I don't know. I mean, I've always been a little bit on the fringe of the colleagues that were drinking the Kool-Aid at the pond, right? So I've always tried not to do surgery, and my colleagues are like, wow, we're here to do surgery, and I've always tried new things and minimally invasive. I've always been trying to push the envelope for something less and something better for people. I have a Hippocratic oath, and that is more important to me, and I'm wired that way than any, anti-Hippocratic government regulation or cookbook or algorithm or Kool-Aid drinking, watered down medical, institutional stuff we deal with every day. So there, I laid it all out there. You'll probably find me buried in the desert tomorrow from some,
there's some,
it'll be a government car with a weird license plate and guys in fedoras, but what?
Then everyone on this show so far is going to be right next to you. So we'll know where to find everyone. It'll be great. That's so funny. Okay, so you weren't really nervous about that. You feel like that was just You've always practiced that way.
Yeah, if you're here to help people and offer them more options than others, how could you not be doing someone a service? At least no one's twisting anyone's arm. We're just saying, hey, have you heard about this new option?
Yeah.
You know, you're not going to hear it. Listen, we have patients come in and I say, hey, we should try this regenerative option for your knee. And they go back and see the orthopedic doctor who recommended the replacement. The doctor says, no, that's unproven. And it's not, no, we shouldn't do that. It's illegal, and all these myths they throw out because the Kool-Aid is very potent.
It's very potent. It's very potent. And yeah, that's the type of stuff I'm talking about when they come, now I prepare my patient. I'm like, listen, when you go to your dermatologist for your psoriasis, they're going to tell you it's not connected to food, and that's okay. Just preparing you that they're going to tell you it's nonsense. But, just try to go dairy-free, gluten-free, see what happens to your skin. Yeah, it's so interesting. Okay, so what is regenerative medicine? What does that word mean? What do you do?
Well, that is the overarching topic title for tapping back into the strategy of what our body does naturally, which is our body first becomes a fetus, becomes a baby, right? And so first of all, we get created through stem cells. Secondly, we grow and develop as a child into an adult. And then third, we maintain, heal, and regenerate, replace ourselves until that process slows down and becomes less effective. And the whole process is mediated by a number of biologics in our body, including stem cells, growth factors, hormones, and cell signaling communicators called extracellular vesicles or exosomes. And we learn from that, and then we use it strategically to help people who can't fully heal something or need help regenerating or fighting against the inflammatory causes of disease.
And aging. So now tell me, okay, someone comes in with knee pain.
Right.
What should they expect? What does that look like?
Well, good old-fashioned doctoring, right? We take a good history. When did it start? How did it happen? How does it bother you? Where exactly does it hurt? Show me. We examine the knee. Is it tender somewhere? Is there swelling? Other outward signs of inflammation, right? The cardinal signs. And then if they've tried all the basics, time, anti-inflammatory lifestyle stuff, some physical therapy, chiropractic, strengthening on their own, what have you. If all those things have failed, and we've looked at their lifestyle and we've tried to suppress inflammation through, proper sleep, diet, exercise, supplements, hormesis, building resilience through a slight stress like hot sauna, cold plunge, exercise, fasting, other anti-inflammatory and anti-zombie cell activities for autophagy, where you clear out the yucky cells and help the young. Then we look at a high quality MRI, and I'm very picky, has to be done just right. Can't be crap MRI. Has to be a 3 Tesla MRI with special sequences called inversion recovery. So, and we do thin cuts and we really break it down and look for targets in the bone marrow adjacent to the joint. And those targets, this is based on the French protocol, the targets in the bone are because the cells that make your cartilage in your joints, the cartilage that's wearing down, the cartilage that eventually wears down to what's sometimes called bone on bone, even though there's always something there, the sometimes referred to broadly and generally as arthritis or osteoarthritis, is a metabolic problem of the bone cells at the edge of the bone that used to be part of the growth plate and made that joint in the first place.
Right.
And those cells that make cartilage are called chondrocytes. So the listeners out there, there'll be a quiz at the end. You may want to write that. Chondrocytes are in the bone edge called the subchondral bone. And this great French study that I follow, they took people that were recommended knee replacement, end stage bone on bone osteoarthritis. And they said, hey, instead of the knee replacement, would you like to join our stem cell study? Because this was started 20 years ago. The other biologics like exosomes didn't exist yet. So they took stem cells. Half the patients got it in the cartilage of the joint and half the patients got it in the bone edge. And the patients with the bone edge did better for longer.
Wow.
Than the patients in the joint. Why is that? Because you think about the cartilage of your joints, it's the biological rubber. It's not very alive. There aren't many cells. It's like hair is a protein produced by a follicle cell, right? So we're stimulating the follicles of the joint that live in the bone edge. So I do my injections there and I would target them based on the MRI. And we are seeing some very exciting results. And this is for educational purposes because, of course, I'm not allowed to make any claims that I can cure anything because
It's an educational podcast.
the FDA has some limits on the First Amendment there. So we have before and after MRIs of people showing a restoration of some of the cartilage in these cases and improvement in the pain and
I was
function.
going to ask you, improvement in the pain. That's what we're looking for.
That's the most important thing. The MRI is just because you hear this, oh, that's unproven. Well, here's some proof.
It's improved. Right.
And here's the French study with 15-year follow-up showing over 82% of the patients are doing great at 15 years.
Wow, that is fascinating. How many times do they have to come back for these injections?
It's a one and done. And, I have a couple patients who got 50% benefit at 1 year, and where maybe we'll look again and see if they need a booster shot. Maybe they had a higher grade of degeneration of the cartilage and I didn't give them enough the first time. So the goal is to do it once, let it restore the joint back to where it should have been for that age, and back to the usual programming so you can use that and enjoy that knee, because we want people, especially as they're getting older, to stay active and stay moving.
Of course.
Release the myokines, you maintain the muscle mass and the bone density, and that you prevent dementia. And
the more active you are, the better, right? We're looking for real health span, not lifespan.
Correct.
And where are the exosomes from? Are they autologous from the person?
Yeah, listen, there are ways to get autologous exosomes, but they're very expensive to do that. It's a prolonged process. And, you don't put old oil back in your car when you change the oil. So we prefer the youngest donor. So these are from FDA certified labs here in the US who go through donor services. The one we use recruits donors in the first trimester of a pregnancy where a planned C-section is the end game. And these mothers are healthy mothers. They're not drinking or smoking, high-risk sexual behaviors, only one partner. They're on prenatal vitamins. They are tested and screened throughout the pregnancy. And at the time of the C-section, the donor services have 45 seconds to remove the amniotic fluid.
Wow.
And in that amniotic fluid, in that baby cooking au jus, there are growth factors and stem cells and stem cell derived exosomes. And the lab we use actually concentrates that down. They test it, they screen it for all diseases, they quarantine it and culture it for 2 weeks. And only then, if it meets their quality standards, do we get these sort of purified amniotic fluid, basically, and in a concentrated way. And it's much less than the cost of stem cells. It does the work of stem cells. And whereas stem cells, if we delivered stem cells in your body, they'd be gone in 10 to 14 days, but their benefits last much longer, if not forever. The reason for that is those stem cells have produced and deliver stem cell derived exosomes to your cells to activate them and make them behave in a more useful, restorative way. We're just cutting out the middleman and going right to the stem cell derived exosomes.
So you're saying the stem cells, do they not have the immediate effect? Is it more long-term?
Stem cells can produce immediate effect in anti-inflammatory behavior, health and wellness. But if you're going to regenerate something, that is a process that we activate by re-stimulating the metabolic pathways of cells, in this case, adjacent to the joint. And we do that, and those cells, instead of fighting inflammation in defense mode, they flip over into anti-inflammatory mode, which is really the optimal functioning of that cell. So it can go back to making collagen and go back to making cartilage, right? So that's what we're doing.
What's the downside?
It's a little bit of money. It's a needle, so you got to feel that. But we do these bone injections under twilight sedation because you don't need to feel it.
To feel it, sure. Bone injection just doesn't sound like a fun thing to do on a Tuesday.
Correct. So a little twilight sedation, it doesn't take long. It takes me 10 or 15 minutes, depending on what we're doing and how many we're doing. And people come in and, we do 2 knees, 2 shoulders, whatever, whatever they need. Some people, it's just one spot. Mm-hmm.
What's a common concern or question that you hear from people about exercise?
Well, these are the myths, right? Number one, isn't this illegal? No, what's non-compliant is if I make any claims that we're curing or treating a disease or condition, because
Okay.
the FDA was chartered by Congress to oversee claims that can be made for drugs or devices, medical drugs or devices. What's done between a doctor and a patient is a sacred, ultimate decision through the process of informed consent.
Yes.
So the FDA does not regulate what doctors do. They regulate what doctors and companies say.
Okay. So
Or can't
we're
say.
not saying anything today. Amazing. All right. That's the
So
first part.
we're saying what we can say, but I'm not making any claims. I can tell you stories about individuals that I've done, or these anecdotes. I can tell you about good clinical medicine and studies published all over the world for 2 decades. So you hear the other myth is, oh, this is unproven. Well, here's the literature.
Right.
Proves it. Here are some results that prove it. Who
Yep.
gets to decide what proof is enough? Some FDA panel that is under the influence of whatever that system is influenced by. And I'm
Yeah.
getting
No,
more
listen, you
going
preach
to
to
be
the people.
buried in the desert.
I feel that I feel that very strongly when it comes to women's hormones, how much it's regulated. And it's like suddenly it's dangerous for you to have the estrogen and progesterone that you've had in your body all along. And you should just live without all the benefits for the rest of your days. I'm with you. It's a struggle. So, okay. So we have those 2 myths. Other
Yeah.
myths that
Yeah. Well, people say, oh, don't I have to leave the country for this? No, it's here. I'm not the only clinic. There are more and more clinics. A lot of doctors are doing this because it's good for patients in the right setting with the right informed consent as an option. Patients should get to choose that option. We're supposed to educate and help the patient choose an option, but it's up to the patient at the end of the day. Other myth is portability. And, the exosomes are a fraction of the price of the stem cells. So while doing the work of the stem cells, and we, treating a joint with exosomes, when you compare it to the cost of a knee replacement, the downtime, the lost work, the pain and suffering, the pain kills, the risks, the complications, deductible, all that. Yeah, about the same in terms of cost. In fact, you may be better on the reject side.
Is there downtime? Like after the injection, do you go back to your life?
Yeah.
Go back to your life.
Most of our patients actually fly into Las Vegas. We start the process remotely through a video conference like this. We order the tests, we get the records, we get to know the person, make sure their body's optimized, for all the lifestyle factors, hormone optimization, things like that, like you were mentioning. Regenerative medicine does better in a body who's more receptive to it. We want those cells to have what they need. And then we only invite people here to town for a procedure if we think it's a good option for them. And they fly in. We have people from all over the U.S., Canada, UK, and we are getting growing numbers of international patients beyond that as well. So that's the easy. Yeah.
What do you think is the main reason that this is not adopted?
It is adopted. You mean not governmentally approved for quality?
Like there is a money conversation here, right? It's not like it's where I could say with hormones, there's no money conversation. It doesn't really cost much to compound progesterone or estrogen. There's this game in there, but what's the reason?
Well, listen, it's already happening, right? Let's talk about PRP, platelet-rich plasma injections, which is a low-level regenerative medicine offering. Many orthopedic and other doctors will do it for like anitis, a tennis elbow, a knee strain or sprain ankle. Athletes get it all the time. So PRP is not approved for marketing claims by the FDA, but almost ubiquitously you can find it in your town.
But not at first, right? At first it was
kind of first. And those of you that don't know, PRP is you take it out of your own blood, you spin it down, you pull out the concentrated growth factors from the platelet layer, and you re-inject it. It's also used for the vampire facial and cosmetic purposes and for thinning hair, which we do with exosomes as well, all those things. But the insurance companies, the bean counters, have finally looked at this and said, you know what? People are getting better with that, and it's a lot cheaper than paying for the surgery. So many insurers are now paying for PRP, even though it's not yet approved for marketing claims. So I think the bean counters are coming around and encouraging the algorithm, since really the bean counters are practicing medicine indirectly.
Yeah, so they're telling us we're allowed to do.
Hopefully this will be a good thing in some ways. And I do see big pharma investing in regenerative medicine significantly. And I don't know if it's going to be good or bad because they'll be able to pay to get this approved. But they will also control the costs and all that tech.
And the quality of their control.
But listen, these are biologics, so we only use the absolute highest quality. Hopefully they don't water it down. Yeah.
That's what I mean.
Yeah.
Exactly. Interesting. You mentioned something I didn't consider for hair loss as well. It's used.
Yeah. So we've talked about spine and joints here, but we do, microneedle facial, help rejuvenate the skin. We do it for thinning hair as part of a treatment of thinning hair because by itself, it's only partially beneficial. We do it for general wellness, IV. We do, we have biohackers, anti-agers who want to slow inflammation. We have people with inflammatory burden, inflammatory problems like autoimmune issues. Diseases of aging have inflammatory components, and we've helped with some inflammatory organ problems, chronic renal failure. We've seen some improvement in creatinine and keeping people away from dialysis. We have some sexual function injections, O shots and P shots we can do with these, just like you can with PRP and things like that. So we have various things.
I haven't considered it for autoimmunity as an anti-inflammatory component. So explain that to me. So I could visually see the bone injection and the rejuvenation, but on a systemic issue like autoimmunity, what's the method? What's the mechanism of action, as it were?
Yeah, it influences cells that are busy producing inflammatory cytokines. And as your listeners probably know, cytokines are the little proteins and peptides that call for the immune system. You may have heard that word during the COVID, cytokine storm causing all this inflammation. So cells in an inflamed person are making all these cytokines and causing the symptoms that people have, whether it's eczema or psoriasis or inflammatory bowels or osteoarthritis, pain in the joints, and all these things and others. So, if you can influence those cells to produce different peptides and proteins, the proteins of repair and of regeneration and of health and wellness, and, get rid of producing those cytokines, you're basically flipping the metabolism, the behavior of those cells into an anti-inflammatory mode using a natural, biologic, and powerful method.
Oh my God. Love it. So that's delivered IV?
That would be IV, yeah.
Yeah, so we can get systemic.
And that's how the biohackers and the anti-agers, help suppress biological age. And we see in the athletes looking for performance enhancement with an IV, we see their heart rate variability, HRV, which a lot of people track with a Whoop band or an Oura Ring or Apple Watch and Garmin devices that they have, we've seen without making any other changes, a significant jump, which is a good thing for HRV, a significant jump for a while. Yeah.
There's some exosomes and it lasts. The HRV variability?
I'd say it lasts, measured in months, depending on how much inflammation you have in your body. I do it myself every 3 months. I do an IV just to, slow the aging process, slow the physiological aging of my cells.
I was going to ask you, but I didn't know if I should ask you if you use it yourself.
Yeah, I do. Family members have come in and tried it, and a lot of friends became patients, and patients became friends. So it's a different group of patients, and they're happy, and they're into wellness, and it's just, you come into work happy, and you leave happy. It's nice.
Yeah, I love that. I love that so much, and I'm especially glad that you mentioned the autoimmune piece because I do have a lot of listeners who are, although I'm sure many listeners also have joint and back issues, but many are like in systemic issues that know me from my world, autoimmunity. So that's a really nice piece of that. What else do you want to tell our mutual audience that maybe I didn't ask you?
Well, let's talk about what's coming. This is just what's here now. I've become a kind of a de facto, whether I like it or not, so like an exosome guy here in the Southwest. And these are stem cell derived exosomes, but there are designer and specialty ones coming that are available in China right now and Europe and parts of Europe. For example, there are exosomes you can have that are overstuffed with mitochondria to help people with frailty and build muscle mass and convert white fat to brown fat, which is easier to lose. Wow. So we're seeing that as well as for mitochondrial diseases, right? And we're looking at some of the dementias being mitochondrially related. And I don't think we give the mitochondria enough credit. If you take your mitochondria they'll take care of your cells, right? So you got to take care of your mitochondria, and it's not just the powerhouse of the cell. There's a lot going on in there.
There's a lot going on. We don't give enough of the concept of mitochondria, the energy. It's not even something that's discussed. We know in functional medicine, energy is a system we talk about.
Right.
But in conventional medicine, you leave mitochondria in school. In conventional.
Agreed. Well said. So those are coming. And then the other one that I'm really passionate about working directly to get in my clinic are specific immune cell-derived exosomes. So we have B cells, T cells circulating around our body, busy, surveying, looking for bad things and removing them from our system. Some of those are called natural killer cells. Well, those natural killer cells help us remove accidental cancers in our body that we have all the time. And IgG cancer cell, not a full-on tumor or something like that. But an NK exosome selectively kills a cancer cell without harming normal cells. So we're going to get those NK exosomes shortly and have that as an augmentative thing for people with cancer or high risk for cancer, want to help prevent cancer. Think about that, to have a amped up NK system in your body.
That's fascinating. Almost should be a rite of passage yearly after age 50.
That, or maybe someone has dealt with some kind of cancer, but it's in remission and you want to help keep it that way. There are so many things people can do for cancer besides chemotherapy and radiation therapy. And you can look this up, right? People are pushed into that realm, but look at high dose vitamin C and, look, just for grins, look up freeze-dried berries for certain cancers. There's a whole protocol and results based on this. Look at exercise, look at fasting. All these things are really good anti-cancer treatments. And probably the best thing would be exercise, really.
Absolutely. And same with dementia. I just finished a podcast with Dale Bredesen. I don't know if you're familiar with him.
You do, yeah.
Sure. And his world of he's saying Alzheimer's is an option at this point.
Yeah, it's a lifestyle thing. Part of our food source needs to get corrected. Yeah. Well, for food, EMFs, but we're self-inflicting for sure.
We're self-inflicting. Is there anyone in the functional medicine world that is not on board with this? Is there any world where the natural holistic world is not on board with this? There's a potential for downside, or because
I haven't met those people, but there's probably like-minded people find each other. So I may not be talking to those. And I deal with a lot, and I'm impressed by functional medicine as well as, naturopathic medicine. And, I wish I had some exposure to that traditional Western medical training. And it's like I'm recommending probiotics for people now, and myself and others. They didn't even talk about that in medical school. Let's get right down to it. Or vitamin D3 supplementation. People on social media, I'm going to go out into the sun and get some vitamin D. Yeah, you activate a little bit, but it's not enough.
That's not it. Bro, they never talk about nutrition. It's really fun to start this. My son is in pre-med right now. And so in pre-med, they're talking he just, I don't know, he did something that had to do with mitochondria. And so in there, you have to talk about how B vitamins are in there and magnesium plays a role and all that. And so he's been listening to me harp away at functional medicine for years. And he's like, why isn't anyone talking about this? And now after this lesson, he will never see this again, right? Once he goes to the med school, they're never going to talk about B vitamins or there's no good conversation of vitamins, but he's learning the pathways right now, right? The intricate pathways.
You only learn, a severe deficiency, right? You learn about scurvy. And if you look at the back of a vitamin bottle and it says that the percentage RDA that you need, that's to prevent the disease of the malnutrition. It's not the optimal amount. So when I tell people they need 10,000 international units of vitamin D3 a day, they go, wow, that's a lot. Well, it's not that much. Trust me. And they, my lab test is normal. Yeah, it's normal. You're not going to have the deficiency, but you want to fight inflammation and live longer because vitamin D3 levels are associated with longevity. Then they start to listen. Yeah.
Yeah, it's interesting. You're right. I do wish we learned that earlier on. We both spent a lot of time. I had to spend a lot of time relearning and unlearning on a lot of things.
Same.
So now tell everyone how they can find you.
Well, we think we're cute here, so we changed the name of our practice to Recelebrate, and that means you are celebrating the renewal of your cells. So whether it's for regeneration, anti-aging, whatever your anti-inflammatory goals are. So if you look up Recelebrate, Recelebrate, you will find us. That's our website, is recelebrate.com. It's our Instagram, it's our LinkedIn, it's our YouTube. It's I think we're the only ones using that word and that name.
And we're also going to put the link in our podcast. And I am really heavily leaning on coming out to you. And when I do, I'm going to video this whole event. I want everyone to see.
Fantastic.
I want to thank you so much for being here. And
my pleasure. Thank you for having me.
Of course. And to everyone listening, click on the link, go on the website, book your tickets to Las Vegas. Don't gamble your money, just actually spend it here. It sounds like a investment.